Coming up next on KPBS Evening Edition, Governor Jerry Brown announces mid-year budget cuts.
San Diego schools catch a break, but half of the county school buses may be parked come January.
And Baja California is trying to win San Diego tourists back. We'll talk with the Secretary of Tourism.
KPBS Evening Edition starts now.
Hello, thanks for joining us. I'm Joanne Farian.
And I'm Dwayne Brown.
California faces another $1 billion in mid-year cuts to schools and social services. But the trigger cuts going into effect next month aren't as bad as expected. Public schools had been bracing for cuts as deep as $1.5 billion. But the cut announced by Governor Jerry Brown today will be $70 million, or about $11 per student. Brown says state revenues were about $2 billion less than expected.
The good news is that the economy of California is recovering. As a matter of fact, this year alone, almost $100 billion of new wealth has been created in California.
Here in San Diego, the reduced trigger cuts mean San Diego Unified will face a smaller deficit than was feared. In just a moment, we'll talk with County School Superintendent Randy Ward about the effect of these cuts and what's ahead.
Additional cuts to higher education could have an adverse effect on California's thriving biotech industry. That's where the average salary starts at about $80,000 a year. The lieutenant governor says state cuts are making it harder to recruit qualified applicants to compete on a global scale. He was a keynote speaker today at a medical innovation conference in San Diego.
So we've cut the UC system $750 million this year and $750 million at the state system in 1 year. And the impact of that is felt on every industry, but I would argue disproportionately on the biotech industry, because that's the feeder into the system.
The lieutenant governor says California's greatest challenge may come from abroad.
The reality is we haven't reconciled the H-1B visa problem. So now we're not competing for talent with the same rules that other countries have that recognize the opportunity to recruit that talent to their universities and then keep that talent as innovators of the future. And that's California's, I think, greatest challenge.
One of the main focuses of this conference in La Jolla is keeping the biotech industry robust as competition from Europe and Asia increases.
The ability to attract talent to our region is important, so while the high salaries are true, so is the high cost of living in our area. So, people, when they weigh the opportunity to come to San Diego, it's not the easy sell that it was 10 years ago.
But we do have some competitive advantages other cities and countries don't have.
San Diego is actually the most concentrated biotech cluster in the entire world. We've got a closeness and a collaborativeness among 600 companies where you could literally walk across the parking lot or across the street to create a partnership and to work together. So we've got a uniqueness here. It really doesn't exist anywhere else in the world.
The conference attendees heard calls for increasing federal tax incentives for research, reducing regulations that hamper university research partnerships, and making science and math education a national priority. Joanne has more on the mid-year budget cuts and their impact on San Diego schools with her guest at the Evening Edition Roundtable.
As you heard, cuts to schools won't be as deep in January as first feared, but they won't go unnoticed either. Joining me now to talk about the impact on San Diego schools is Randy Ward, San Diego County Superintendent of Schools. Thank you so much for being here.
Good to be here again.
So $1 billion in cuts overall. Do we know what this means for K-12?
Well, K-12, for most districts who do not have transportation programs, it's a $10 to $15 per child cut, kind of negligible. For a district as large as San Diego Unified, about $1.5 million.
Oh, so they thought it was going to be about $30 million.
They thought it was going to be 30, but now they're getting a transportation cut, which actually for them is about $4 to $5 million. And what that transportation cut does to the small school districts is actually devastating, because many of those rural areas have children that are living far away from school. They don't have sidewalks, and many of those students get transported by buses every day. And so that is the disproportionate burden that the state has laid on very small school districts like Julian, Ramona, Borrego Springs. Those districts will feel the impact of this cut much more than the the larger districts.
I want to read a quote here from Tom Torlakson. He is, of course, as you know, the state superintendent of schools, because he talks about this just after the governor's press conference today. He sent out a statement and he says, mothballing school bus fleets across the state will mean many rural, disabled, and low-income students literally will have no safe way to get to school. Children will lose childcare, students will lose the opportunity for a college education, and our overcrowded classrooms will continue to be jammed with 35 to 40 students. So we've got 42 school districts here in San Diego County. How many of them really rely heavily on this transportation?
You know, they're very small districts, got about 14 or 15 very small districts, but there's a number of others that use transportation just because of their geographical area. And what could happen with these districts as they look at their transportation programs, they may need to, and many will have to, take money and resources from elsewhere, other programs, class sizes, which is what Torlakson was talking about. They may need to do that area and cut classified staff, which, by the way, the only staff you can cut mid-year.
The non-teaching staff.
The non-teaching staff, the non-credentialed staff. They may need to do that in order to maintain transportation, because without transportation, your students won't come to school. And without your students coming to school, you're going to have to cut more. Because you're not getting the dollars generated through average daily attendance.
We mentioned San Diego Unified. Now, you've been on the phone with them already since this announcement was made. So what did they say to you? Were they relieved?
Absolutely. There's no question about it. What they were looking at was a $30 million, potentially $30 million mid-year trigger cut. And that has turned into somewhere around 6 or 7. And so it's about $4.5 million for their transportation, and about $1.5 million. There are 115,000 students times $10, $15.
Right.
So they're actually looking at some light at the end of their tunnel.
Now, we're talking mid-year. That means in January. So when we talk about these transportation cuts, these school buses that get kids in rural areas to school, kids with special needs, as of January, February, that school bus might not be there?
As a matter of fact, January 1st, these cuts are executed automatically. They happen. And then the $79.6 million, which is the revenue limit, the number of dollars per student, that gets implemented February 1st. So these are automatic. There's no bill that's needed. The legislature doesn't need to talk about this. Now, they may come back in January and try and play with it, and that will be the interesting politics between the legislature and the governor.
Now, you were here a few weeks ago when San Diego Unified was talking about insolvency. It doesn't look like that's going to happen. But you said, sort of, in terms of the big picture, school districts have to make choices. Budgets are about choices, and there's so many things you can do. Your classrooms can get bigger. You can deal with teacher salaries in negotiations, a number, some options available. What are you going to tell school districts now going into next year? Because the cuts aren't over. The governor's already said that.
Well, see, we're going to go into another period between January and November of uncertainty. So because of the governor's tax plan, there's going to be a deferred something that goes for the next year's budget that says, you know, there's $7 billion out there that we're going to count as revenue. But if we don't pass this tax plan, we're taking it from the schools.
What you're talking about, the tax plan, so the people at home know, it's a ballot initiative that the governor has introduced, that he filed with the Attorney General, that says, I want to raise taxes on the wealthy temporarily and raise the sales tax temporarily by half a cent, generate $7 billion that goes directly towards schools.
And programs, and programs for poor. So, so now we're going to have a situation where we need to then decide on what our worst case scenario is once again, and we have to budget as if the $7 billion doesn't materialize, because if it does, our budgets go.
But how can you do that? How can you sort of say, okay, I'm going to budget, we might have $7 billion or we might not. That's a lot of money.
Welcome to our world in K-12 public education. It's a very difficult thing to do. Could you do it with your own household? Families can't do it. You don't know how much to buy every day to put in the fridge. It's a very difficult situation in public education these days.
Randy Ward, thanks so much for being here.
Thank you for having me.
It's the #1 cause of accidental death. A look at the dangers of overdosing on prescription drugs in just a moment on KPBS Evening Edition.
Masterpiece Classic. Step into Downton Abbey.
Downton is a great house, and the Crawleys are a great family.
Do you know the new heir is Robert's third cousin?
I thought Lady Mary was the heir.
Girls can't inherit. Don't you care about Downton?
I've given my life to Downton.
Coming up and changed me.
Why are you so against him?
He isn't one of us.
Welcome to Downton.
Downton Abbey on Masterpiece Classic.
Downton Abbey returns Sunday at 9 on KPBS.
American Masters presents
Every kind of visual treat you can imagine.
Charles and Ray Eames, the architect and the painter who became the top husband and wife design team of the 20th century. From furniture,
the Eames chair,
to filmmaking.
The concept is mind-blowing.
They thought outside the box before anyone even knew there was a box.
Charles and Ray Eames,
a happy, modern couple absorbed in their work.
Enjoy Eames on American Masters.
Monday at 10, only on KPBS. KPBS Evening Edition is made possible by Joan and Irwin Jacobs and by
The leading cause of accidental death in San Diego isn't car crashes or firearms, it's prescription drugs. Over the last decade, prescription drug-related deaths have increased by 85% in the county. KPBS health reporter Kenny Goldberg tells us the vast majority are caused by overdosing on painkillers.
Everyone in San Diego who suffers an accidental or non-natural death is brought to the county medical examiner's office in Kearny Mesa. Each body spends some time in cold storage before it's wheeled into another room for an autopsy. Deputy Medical Examiner Jonathan Lucas makes his living figuring out the causes of a person's death. He says recently, more and more San Diegans have been killed by an overdose of prescription drugs.
The biggest issue within the prescription drug problem are really the narcotics, the opiates, the pain medications, the morphine derivatives, the opiate derivatives.
In San Diego County last year, 5 widely prescribed drugs, methadone, oxycodone, Valium, hydrocodone, and morphine, killed 222 people. That's more than died by alcohol and heroin combined.
Most of the deaths that we see are people in the age range of about 40 to about 60. And these are the people that generally have problems like chronic pain. And they have a legitimate reason to have these medications, but they may mix or borrow or overtake their medications more than prescribed.
In another part of the medical examiner's building, all of the medications seized at death scenes are stored. Chief Medical Examiner Glenn Wagner says he's noticed a big rise in the quantity of different drugs people are taking.
This shopping bag represents one individual and the number of drugs that person had on board. There are 19 separate lines on this one, and it goes for several pages.
Special Agent Tom Lennox keeps a watchful eye on prescription drugs in San Diego. He says people don't seem to have trouble getting narcotics.
The prescriptions are being written, they're getting out into the community, so they could be getting them from their own home. They could be getting them from friends' homes, where they're going in and stealing them from their friends' homes.
Lennox says in 2008, one of the most popular drugs on the street was the painkiller OxyContin in 80-milligram pills. Lennox decided to track how many of these pills were being distributed to San Diego pharmacies.
We found that there was approximately 675,000 in 2007. When I looked at 2008, it jumped to almost 1.1 million, almost an additional 500,000 pills.
Clearly, a lot of these drugs are being prescribed. They're also being sold illegally on the street. And law enforcement officials say there's been a big increase in burglaries and robberies at local pharmacies.
The pain's still there.
But physicians are the major source of these drugs. Dr. Robert Wales is a pain specialist in Encinitas. He prescribes narcotics to his patients all the time.
They provide tremendous assistance for those people in chronic pain. So used correctly, they're wonderful. So
it's hard to put a judgment call on the narcotic themselves. It's how they're utilized and the people that use them.
Dr. Wales concedes there are people who get the drugs legitimately and then sell them to others.
We actually look for that routinely. We actually routinely check urine samples to see if they have the medicine that we're prescribing in their urine. If they don't have that medicine in their urine, then we have to suspect that it's going somewhere else.
Dr. Wales says in general, physicians need better training on how to prescribe drugs for chronic pain. But he believes the issue is much bigger than that.
I think what we need to understand as a medical profession is more about addiction. Because what we're talking about is not the tip of the iceberg, but only part of a bigger problem. And that is addiction, and it has to do with alcohol, it has to do with other illicit drugs, as well as prescription medication.
The county medical examiner's office sees the end results of addiction every day. But Dr. Lucas points out only a small proportion of people who abuse prescription drugs die.
So whatever number we're seeing here in this office every year, the problem is many times greater than that.
That story by KPBS health reporter Kenny Goldberg. Federal authorities say prescription drug abuse is the nation's fastest growing drug problem. A new report says the FBI is looking into billing practices of the owners of Alvarado Hospital in San Diego. Prime Healthcare also owns Paradise Valley Hospital in National City. California Watch says agents have interviewed 2 former medical coding employees after reports the company charged Medicare higher rates than other hospitals for treating elderly patients with rare conditions. Prime Healthcare says it's following all regulations and it's not aware of any federal review. It may be a few months before there's a decision about whether to build a new power plant along the coast in Carlsbad. The proposed plant would go right next to the existing Encina power station, which the city of Carlsbad wants removed. It wants the coast to be more tourist-friendly, and having a power plant there would scuttle most of its plans. California's independent systems operator says the new plant may be needed. The State Energy Commission is expected to make a final decision in the spring. A preservationist group is launching a petition drive to save the Caliente sign on the California Theater downtown. Last night we told you about plans to paint over the sign to make way for a beer ad. Now, the Save Our Heritage organization wants the city's Historical Resources Board to weigh in. The group says city planners made a mistake in deciding it was not historic. Well, that sign was put up in the 1960s to attract American tourists to the old Caliente racetrack in Tijuana. Over at the Evening Edition Roundtable, Joanne is talking about efforts to draw people back to Baja.
Officials from Mexico are on a campaign to convince American tourists their country is a safe destination. Reports of escalating drug cartel violence since 2008 have kept some U.S. visitors away. Joining me to talk about efforts south of the border to bring tourists back to Baja California is Juan Tintos Funke, the Baja California Secretary of Tourism. Thank you, Secretary, for being here.
Thank you, Joanne.
So first tell us how tourism has suffered in Baja as a result of the reports of violence.
Well, it was really a tough period between 2007 2008. It went down between 40 to 65%, according to the type of tourists, because we have tourists in Baja California that come because of different purposes. But we like to think that we're on the rebound for the first time in 3 years. This year we're going to close with a 5% increase in general throughout the state.
That's in terms of Baja, because we know some reports have said that in 2008, all of Mexico, there was more than $13 billion in tourism, international tourism. It's down to less than $4 billion now. What are you doing in Baja that sort of you're managing to sort of see increases, whereas other parts of Mexico are seeing decreases?
Well, tourism, you have to monitor it very closely all the time, because it's a very unique economic activity. What we did was analyze that we were facing certain elements that may have been there before, like the image, the perception, but the economy, health purposes, even with influenza. So we innovated.
The swine flu, you're talking about when the swine flu went through Mexico?
Yes, with the swine flu. And we sort of had to go back to the drawing board and reconstruct our tourism project program. And we've done a lot more PR. The proof of that is my presence here. We needed to come more across the border and put the word out that, in our case in Baja California, we just finished a major Hollywood production. We're going to start another one in January in the studios in Rosarito Beach. The cruise ship companies have continued going into Ensenada. Different numbers that we have more participants in our bike rides, in our off-road races, plus with the help of the expats. You have to know that over 50,000 Americans live full or part-time in Baja California, and they've joined what we formed as an image committee, and they've helped us put out the word. And these are former CEOs, NFL players, people who have a second home or a condominium or even a business in Baja California.
So, no doubt, I mean, Baja California is a beautiful place. We're going to show some images now. I mean, I don't think you really have to make much of a case there. It's really people feeling safe. And we've got, you know, juxtaposed next to these beautiful images, you hear about murder rates. In 2008, started escalating. I think there were 800 murders in Tijuana. Now it's about 400. How do you convince people that this is a safe place?
Going to Baja California is to going like to any other tourist destination in the U.S. or the world. You always will run a certain hazard, but if you do your agenda, if you stick to the tourism routes, and if you go into these tourism destinations like ours in Baja California, you'll find out that we haven't had tourists targeted because of violent crimes or related to the areas where tourism normally goes on. So we have services. We have a 078 pre-information and assistance line. We have bilingual personnel that works 7 days a week. The municipal governments have put in force bilingual personnel police, even a bilingual binational traffic ticket, so which we don't want to give too many of those out, but we're very conscious now that American tourists are also looking for bargains. That's a big difference. Before, the economic problems for the travelers used to be just for Mexico. The difference this time that we realized is that we had to be more competitive because we started seeing tour packages prices compared to Palm Springs or Florida or Hawaii. So we reconstructed that also, and we've made much more affordable tour packages and overnight stays and meals and everything.
How much do you rely on San Diego, the San Diego tourist, whether it's the person who lives in San Diego who's going to Baja or the person who this is maybe their destination, but you might convince them also to go across the border? Well,
we depend a great deal on San Diego, but we depend more as we go further north, especially the LA County, Orange County, San Bernardino. But there are people who like to go for shopping and having the famous Baja Med cuisine, which has also put us on the map. We've had Iron Chef Rick Bayless and chefs from all over the U.S. and Mexico come and be at our restaurants and go through here. The wine country, we produce 90% of Mexico's wine. A lot of people don't know. It's a very well-kept secret, which we want to make more popular. So people like to come from San Diego, North County, maybe for shopping and dinner and going back, but others are looking to stay over. Medical tourism is also has become very important. We have the #1 spa in the world in Rancho La Puerta in
That's
Tecate.
right, and our audience knows that spa well. Thank you so much, Secretary Quintos, for being here.
Thank you.
Did you hear? There was a food fight of sorts in Kearney Mesa today. About 20 food trucks gathered at an auto dealership to raise money for Meals on Wheels. The truck operators donated 20% of their sales to the program. It distributes 400,000 meals a year to senior citizens in San Diego. This is KPBS Evening Edition.
I'm Judy Woodruff. On the next NewsHour, Congress wrestles with an extension of the payroll tax cut. That's Tuesday on the PBS NewsHour.
The American people have named PBS the most trusted source of news and public affairs.
For the 8th year in a row.
Trust.
The American people have spoken.
Thank you.
Love the way you treat me so badly. I'm no better. Can't wait to tell you I got it on camera. You and me are irresistible. In too deep, it's irresistible.
Welcome back to the Public Square on KPBS Evening Edition. As you just saw, the Secretary of Tourism for Baja California is on a campaign to convince Americans his state is safe for tourists. We asked our Facebook followers if they felt safe going to Baja. Here are some of their responses. Brian Woodward says, I used to travel to Baja twice per month to surf and camp with friends. I love the people and natural beauty of Baja, but it is too risky. Too many crystal meth heads, corrupt cops, and brutal drug gangs to risk my life, property, or the safety of my wife and dog. But Sharon Kennedy says, I go very frequently to Baja and feel very safe there. And Carrie Schneider wrote, my friends won't go camping anymore. Well, you can tell us what you think by following us on Twitter, liking us on Facebook, and of course you can email me, jfarian@kpbs.org. And now let's go back to Dwayne at the news desk.
Governor Brown announced mandatory trigger cuts in state funding for education and social services today, but the cuts were less than the forecasts had predicted. San Diego Unified had been bracing for a $138 million deficit, but since the state cuts weren't as deep, the projected shortfall is only $60 million. You can watch and comment on any of the stories you saw tonight on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night. The Weather Service says it's going to be a very chilly one over the next few days, right into the weekend. We leave you with a look at the forecast.